Yeah. So efimosfermin is an FGF21, and FGF21s have been very promising in the field of MASH, right? We have two agents that are now in phase 3. Efimosfermin is in phase 2. We just presented the phase 2B data on liver biopsy. And as you know, FGF21 is one of the most effective mechanisms in MASH. It has a role in metabolism, anti-inflammatory, and also anti-fibrotic. Um, so FGF21 is, or efimosfermin is FGF21 with a long half-life. So the administration of this drug, it's once monthly, which is very attractive, right? You give a shot for the patient once a month and you're done. And that's why it's one of the very promising one. It works on the FGF21's receptors with the beta as a co-receptors, and it does the job. So this agent has been a little bit under the radar until the presentation. And what happened is they presented previous data with MRI PDFF, MR fat fraction data, and it was fantastic. So we moved to the phase 2B after the phase 2A MRI PDFF data, which showed remarkable MRI PDFF reduction of the fat on these MRIs. The phase 2B was designed to look at safety, but also we had histological endpoints. The first one is NASH resolution without worsening of fibrosis, and the second one is fibrosis improvement without worsening of NASH. So there were two arms, placebo versus the 300 milligram, which is subcutaneous, again, once monthly over 6 months. So the trial is only 6 doses. So with the 6 doses, we had MASH resolution of up to 40%. We had fibrosis improvement up to 24%, which is remarkable in 6 months after 6 doses. And that was over 24 weeks. There were also data that we looked at MASH resolution and fibrosis improvement at the same time in the same patients. That was about 20+%, was new statistically significant because the sample size is small. So we're very excited with this 6 months data that these results were significant, and we're going to carry it to phase 3. The study also has extension where some patients are going to be biopsied at week 48, and we'll see if there's any additional histological improvement like we have seen in other FGF21s. That's a very question. And the safety with this drug is very, very important. Why so? Because interestingly, and maybe because it's synthesized in a million cells, the side effects profile was on the very good side. There was some GI side effects, but it's a very low prevalence in this patient population. And it was very well tolerated drug with no major dropout, no major safety issues or serious adverse events.